Thank you so much, Dr. Felix, for joining us, our medical director and veteran ER physician.
Thank you for having me. Rashes, lovely.
Yeah.
I know you love that. I don't know if you care.
Love looking at them, love smelling them.
Let's start with ticks. Can you tell us, they seem small, but they cause a lot of anxiety, especially with concerns about Lyme disease. If you can elaborate, how does it happen, and what once it's there, what do we do?
Okay, so in general, the problem with ticks is they could carry infections and can infect people once they bite them. Lyme disease is a big one, but there are other diseases to take into consideration as well. Babesiosis, Rocky Mountain spotty fever, some of which are not necessarily in the Northeast, but things to consider. But a tick bite, once it occurs, if it's attached long enough, it can then transmit these pathogens into the body, and a person can get sick from it. Connecticut is known for Lyme disease. It was discovered in Connecticut, so hence the name Lyme, right? And the problems that can occur is that the disease can affect different parts of the body, including the heart, joints, the nervous system. So depending on the severity of the illness, depends on the manifestations, and sometimes it can be difficult to treat. So that's the big concern. You don't want to get bitten by a tick and have it untreated and potentially suffer the consequences of the disease.
Going back to that question, where does tick come from most frequently? I hear it's a lot of times from animals like deer and so forth. And
it's actually probably more mice, rodents that actually carry it. But what ends up happening is during their life cycle, they try to attach to animals, mammals primarily, and they sit at the end of leaves, grass, whatever, with their claws out, ready to latch on to something. So then, when you're out in the woods hiking, obviously you should wear insect repellent, try to wear light clothing, ticks are dark, be able to identify anything that may be crawling on you, and always do a tick check after any kind of hikes. Also keep in mind, pets can also carry them and bring them into the home, especially if you live in a wooded area and they come back inside and, provide you with unwanted guests in the home, right?
Got it.
So just be mindful of that. But once they attach, right, then they bite into the skin, they feed on you, and they transmit their pathogens to you.
How does a person know that person was not bitten by a mosquito or ant, but was bitten by a tick? What's the symptom, or
Ticks attach. They stay on the skin, as opposed to a mosquito bite. That lovely little bug takes the blood and goes away, right?
Yeah.
Ticks actually stay on board. Ticks don't jump, they crawl. Right. The way to get attached is, as described earlier, they sit on the end of plants waiting for somebody to come by and grab on. So once they get on, they stay attached, and usually you would find something attached to your skin. Sometimes you could have gotten a bite and not realized it. It may have been there and gone unnoticed, depending on the part of the body. And then you may have, symptoms that manifest, days, weeks, or even months later.
So quickly, before we move on to the next skin scary, what should a patient do if they realize that they got bit by a tick?
Oftentimes, we'll do prophylactic antibiotics just because of the strong likelihood of a tick-borne illness. If you don't have any symptoms and you didn't realize or you forget, you could always get tested for it later. If you develop symptoms, sometimes it's kind of difficult from the provider perspective because they may come in with things that sound like joint aches or pains that, who doesn't get those,
Yeah.
But if associated with some other concerning features, then, maybe a tick-borne illness would be considered and testing would be done.
Yeah.
So it can sometimes be a little bit of a diagnostic dilemma.
So from a provider's perspective, if you get bit by a tick, it's always best to just come in and get diagnosed.
You wouldn't have the diagnosis necessarily right away in terms of disease, but prophylactic antibiotics can be given.
Yes.
In order to potentially prevent the onset of an illness.
Got it. Our next topic is going to be poison ivy. So that's a good one. It's that time of the year where people are working in their yards. So just quickly go through, from a provider's perspective, what should a patient do and when should they come to the urgent care?
Avoid them. What?
Tell my husband that, please.
So, but that said, it's oftentimes difficult to avoid if you have a large amount in an area or it went unidentified and you came across it. The problem with poison ivy, poison oak, Sumatra are the oils in the plant that actually cause an allergic reaction. Not everyone is allergic to it, but there are a lot of people that are. With it could be very uncomfortable to have this rash. Depending on the severity, will depend on what kind of treatment. Sometimes you may need a prescription medication, steroids to combat the inflammatory response, the immune response to the oil. But then other like basic things to do are taking the clothes and washing them. Try to get the oils out. Yeah, those are the big ones.
Can it spread if somebody touches?
So the oil, if it's still present, like that's why you have to wash the clothes. It can contaminate other parts of the body. So even if you're no longer by the plants, but you have contaminated clothing, then you can actually touch anything else with it and get that.
So it's better kind of like sanitize once it has happened.
Yes.
Like sanitize all your clothes that you have been wearing and or bed sheet and stuff so that you are not causing more trouble to yourself or others who might get in touch.
Yeah. I mean, the thing about poison ivy also is that the kind of reaction it is, you often wouldn't get it the first time, but it's the repeat exposure. That's when your immune system gets primed to it.
Yeah.
So, but either way, avoiding the oils which come with the plant, I'm unsure how that will happen in bedding, but it would be kind of interesting. Maybe somebody doesn't like you and put your bed. Right? Who knows?
Oh boy, don't give any ideas.
Oh, you're sleeping in the woods. That's a possibility. If you go camping, that's a definitely a concern.
So one of the other skin scaries is sunburn. So let's talk a little bit about that. I know sunburns can be very mild, but they can also be very severe. So at what point should a patient say, I think I need to do something about this sunburn?
Blistering would be a concern for like a deeper burn. Most sunburns are going to be superficial, uncomfortable. For those that care about youthful appearance, avoiding the sun and having a high SPF would be paramount to reducing the amount of wrinkles you'd have. So that's one thing. But besides that, the amount of pain could be very uncomfortable, and the location. Right? If you have something on your forearm, it's probably not as bad. You have something on your back, you went and laid on the beach with exposure to the sun in the Caribbean, and expecting it to be similar kind of exposure as somewhere in the Northeast, you're probably gonna have a more severe burn at that point, and wearing clothing on top of sunburned skin can be very uncomfortable. So some things we can do is, provide, medications for pain relief, and give suggestions in terms of like local, like wound care.
Gotcha.
Is there a regimen like, okay, I'm starting for the day and I'll be at the beach for the whole day. Do I just put it on once a day or in the morning and be done with it? Or is there like a frequency or depending upon the heat and whatnot?
Yeah, you're talking about sunscreen, right?
Correct,
yes. You want to apply it, I think like about 20 minutes before going outside for it to settle.
Yeah.
And then if you're going to be outside, you need to reapply, especially if you're going to be in water.
Yeah.
And things get washed off. And also realize that when you're in the water, you're actually getting exposed to the sun as well. So a long time in water is likely going to give you a sunburn as well. Okay. However, you don't feel hot while in the water, but you are getting sunburn while in there.
Got it.
So the constant reapplications, the timing of which I'm not sure, but definitely if you're getting into water, reapply.
Got it.
All right. So to summarize, tick bites, poison ivy, and sunburns can be minor, but can also be turn into major really quickly. And that's where we come in as an urgent care. And that's where we can come in, help treat you fast, affordable, and no appointment necessary, which is the best part.
Actually, one thing I did want to add is, heat strokes, heat exhaustion, other things to consider. You want to try to stay cool in warm weather. We're hitting some of the summer months of the year, and you always want to maintain hydration. If you find yourself getting like being in a hot environment, not sweating, that's always a bad sign, right? confusion, always a bad sign. You're starting to get confused. You're afraid that like your brain is actually cooking. You're getting a little bit too hot. So those are some emergencies. A lot of prevention will help. Be mindful of that, basically.
That's great. Thank you so much for listening today to Urgent Care Unscripted. And you can find us at 354 Sawmill Road in West Haven.
And enjoy summer, be safe, and when in need, contact us at AFC Urgent Care West Haven. We welcome you to continue watching our episodes, and I thank Barbara and Dr. Pacheco for joining us today.
Hey, thank you. Have a good one.
Bye.